Intestinal parasites are living organisms that utilize other living bodies to feed and survive. They live inside a living organism, known as the host, and feed on its nutrients. Parasites enter the body through the food we consume, water, or air. To thrive and multiply, they consume nutrients from the ingested food and the mucous membranes of the areas they inhabit. These parasites can reside anywhere in the body, with the intestine being their preferred environment for development and reproduction. Intestinal parasites can enter the human body due to poor hygiene, such as unwashed hands, consuming contaminated food or water, living in impoverished conditions, eating insufficiently cooked or raw meat, contact with contaminated persons or animals, and through pathogens such as viruses and microbes from the surrounding environment transmitted through insect bites. Individuals with weakened immune systems are more susceptible to parasites. Intestinal parasites can survive for a long time, even years, without causing any symptoms. Helminths, commonly known as intestinal worms, are multicellular organisms with lengths ranging from a few millimeters to several meters. They feed on the contents of the intestine or the blood from the intestinal walls. Examples include helminths or the disease known as dirty hands, roundworms, tapeworms, and pinworms. Protozoa are microscopic organisms, and the simplest in structure are unicellular. Parasitic protozoa, such as Giardia lamblia, the plasmodium causing malaria, blastocystis hominis, etc., cause diseases in both humans and animals. These organisms multiply within the host's body. Symptoms that may raise concerns about the presence of intestinal parasites in the body and prompt us to seek medical consultation and investigations regarding the type of parasite. Stools with blood, anal itching in the case of pinworms, abdominal pain, nausea, diarrhea, constipation, feelings of nausea, headaches, drowsiness, fatigue, loss of appetite, anemia, elimination of worms with feces, bloating and intestinal gas, weight loss, allergy, or sensitivity to certain foods. Preventing infection with parasites includes regular hand washing, consuming safe and well-cooked food and water, maintaining hygienic living conditions. Treatment may involve the administration of medications prescribed by a doctor. Additionally, there are natural remedies that can help combat parasites. Products from certain medicinal plants, such as extracts, tinctures, capsules, teas, etc., are an effective natural remedy in the fight against these parasites. They strengthen and fortify the body's immune system. However, their administration should be done with the doctor's approval to avoid interference with prescribed medication. Nuccal negru, black walnut. Preparations from black walnut are an effective natural remedy for combating parasites and fungal infections. Osterol, garlic, consuming garlic and garlic-based preparations are effective against Giardia and other intestinal worms. Tamater is a natural remedy used since ancient times for eliminating pinworms and tapeworms. The infusion from this plant is recommended. Pumpkin seeds are used as a traditional natural remedy to combat tapeworms and pinworms. Wormwood-based preparations are an effective remedy against intestinal parasites such as Ascaris lumbricoides, Giardia, Plasmodium, etc. Cloves-based preparations, especially the powder, are effective against intestinal parasites. It is important to consult a doctor before starting any treatment and to maintain proper hygiene to prevent infections with intestinal parasites.